Instead of heading into a summer like last summer of isolation, uncertainty, and loss, we're headed into a summer of joy, celebration, and increasing freedom from the virus.
A summer of joy brought to you by last year's heroes, the doctors, nurses, and hospital staff on the front lines of COVID. New book follows 6 of those, quote, ordinary people doing extraordinary work. Medical students who graduated early to help in the COVID wards. With me now, Emma Goldberg, the author of Life on the Line, Young Doctors Come of Age in a Pandemic, and Dr. Gabriela Ulloa, one of the book's subjects. Hi, good to see you both. Dr. Ulloa, I'm going to start with you. You finished medical school in April 2020, immediately started to work in a New York hospital. What were those first few months of the pandemic like for you?
Yeah, so I think a lot of us actually who graduated during the pandemic, we came in kind of at the height of at least New York City's first wave. And it was very scary. Just being an intern itself is scary, despite not even being in a pandemic. So yeah, it was scary, but I had a lot of support staff, nurses, everything to help me along the way. So it was really nice to be in that supportive environment during this time.
Emma, one of the reasons I found your book so compelling is that we know what we have lived through in the short term, but there are so many long-term questions about the way that COVID is going to change us as a society. What stood out most for you in your conversations with these young doctors?
Thank you so much for having both of us on. It's a treat to be here. I think one of the greatest takeaways I had from my reporting on the book was the idea that courage doesn't always look exactly like we think it's going to look like. I think when I started out the reporting, I anticipated that the greatest source of fear for a lot of the doctors I was following would be the sense that they themselves might fall sick. And that was certainly a concern. But I think even deeper was the worry that they wouldn't always be able to do the life-saving work that they'd been trained to do. There was one young doctor I followed in Life on the Line who admitted his first patient on his first day, and within hours that patient passed away. And the first ever medical note he signed as a doctor was a certificate of death. And that's not something that any doctor intends to do. These are people like Gabriela who are trained to do life-saving work, healing work. And in some cases, in the midst of the COVID crisis, that wasn't possible. And I think following these young doctors who had the courage to do the work, even when they weren't able to save people's lives, and even when there was so little known about the disease, that was an incredibly inspiring story for me to follow and to be able to share with the readers.
Yeah, Dr. Lowe, do you have a sense yet of how this is going to change your approach to the work?
I think it already has changed my approach to the work, right? Coming into a pandemic like this, you just have to change the way that you care for patients. You know, in medical school before the pandemic, we were taught spend as much time with families as possible and make it really a patient-centered approach to medicine. In this sort of pandemic, in this environment, we really had to figure out ways to still do that, but through virtual means. And also without spending so much time with the patient that you would put yourself at risk for getting sick. So I think it's actually going to change a lot of the world of medicine, let alone my approach as well.
Emma, the faces of medical care are changing. That is a truth that you capture in your book. What does that then mean for the field as a whole?
I think that's a critical issue in the context of a pandemic that disproportionately hit communities of color. And I'm so glad you raised that. I remember in the early weeks of the pandemic in New York last spring, there was a report from the city that showed that Black New York City residents were dying at twice the rate of white New York City residents, and so were Hispanic city residents. There was also an overrepresentation of hospitalizations and case rates in those communities. And I think that sharpens the calls to boost representation and diversity in the field of medicine. Right now, just around 5% of American doctors are Black, 5.8% are Hispanic, and we have access to more and more research that shows that patients have better health outcomes when they're seen by doctors who look like them. They're, in some cases, more likely to agree to preventive health measures like cholesterol tests and diabetes screenings. So that means that when we talk about diversity in the field, it's not a soft, nice to have issue. The stakes are people's health and people's lives. And I think the pandemic that disproportionately harmed communities of color should sharpen the calls to diversify the field and to continue opening the pipeline to more and more doctors of color.
Yeah, I mean, Dr. Lowe, especially because you can study this question of inequity as an academic question. And then I have to imagine for you being out there on the front lines at the height of this pandemic, it came into sharp focus in a very real and practical way.
It truly did. And I'm a proud Hispanic Lebanese woman. So for me, it really hit home very hard seeing people who looked like my family members getting very sick and having to take care of them from that, and not having the opportunity to have all of the staff around you speak your primary language. And so that's where my Spanish skills came into play there. And one of the reasons why I got into medicine is to be able to be that representation, especially for pediatric patients, because I want them to see people like them in positions that they can attain one day.
All right, Emma, Dr. Ulloa, thank you both. Emma's new book is Life on the Line, Young Doctors Come of Age in a Pandemic.